Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today's topic is pains diagnosis. When you talk about pain, you are talking in terms of the sign and symptoms of a disease state. But research has gone on further to even now see or proven that pain in itself could be a disease, so that it should now be taken as a primary health concern. And that is what I am trying to expose to you, that when you are talking of pains and as a disease, then it means there are certain laboratory investigations that could be done, and that is where my interest is, or the interest of a person that continues to have chronic pains should be, so that you get resolution of this chronic pain. And by that I mean the factors or parameters that have been affected, either made more pronounced or reduced in quantity, could now be affected to reflect a normal parameter that would take the patient out of that pain. So to understand it more, we shall go into the fuller study as I move into the slide section. As usual, if you like my presentation, you click the like button, subscribe, and you will continue to be satisfied with my production. The objective: to show the genesis of pain and how it causes certain derangement in values of some parameters estimated in the laboratory, as expected of any disease-causing agent. Introduction. Pain is a subjective feeling, and only he who feels it knows it. But it could be researched upon using non-parametric research tests that depends more on questionnaires for rating. Pain is most often grouped by the kind of damage that causes it. The two main types are pain caused by tissue damage, which can also be called nociceptive pain, and the pain caused by nerve damage, also called neuropathic pain. A third category is the psychogenic pain, which is pain that is affected by psychological factors. Psychogenic pain is expressed more in fears, depression, stress, or anxiety. In some cases, pain comes from a psychological condition. Pain-sensing neurons are called nociceptors. They respond to extreme temperature, pressure, or chemicals from damaged cells. Nociceptors are found throughout our skin, muscles, bone, and internal organs. Once the ascending message reaches the brain, it is translated and we feel the pain. It is therefore easy to classify them thus: muscle pain, back pain, joint pain, musculoskeletal pain, and so on and so forth. Myalgia. Let us treat a very common type of pain, muscle pain, which now has a fancy term: myalgia. Muscle pain is usually experienced when we overexert ourselves. It could also be an indicator or symptom of other serious conditions like fibromyalgia. Fibromyalgia is a chronic pain, muscle pain that affects every part of the body, because the feet, the legs, the arms, the abdomen, the back, the neck. It affects every part of the body, and being chronic, that tells us that there is the acute type of muscle pain. But when you are starting to have a chronic type, it may be fibromyalgia, and that is when muscle pain continues, or pain continues for more than 3 months. It is classified as chronic. There are 4 major types of muscle pain. There is muscle contracture, which is gotten from sustained muscle contraction. things you do, that muscle cramp from involuntary contraction of muscle stiffness from muscle strain, feet not moving at all, and muscle ache from nutritional deficiency, dehydration. I'm sure many of us have experienced all these type of muscle pains, and you can't really explain how it feels. But when it is fibromyalgia, the pain is more serious. Burning pain. At times you cannot even walk. You stand. It disturbs the sleep. It is a serious type, and it's going to be the one that we are going to use to explain pain now being a disease, that is pain causing these different type of diseases. Pain as a cause. Allostatic load hypothesis. This theory posits that persistent exposure to deleterious social and economic conditions activates the human body's fight or flight response to a state of perpetuity. In turn, the persistent accumulation of stress hormones, such as cortisol, has been robustly correlated with a number of diseases and negative health outcomes. These are the researchers, Brunner, that did it. And looking at this hypothesis, this theory, one could easily conclude that the continuous pain, even without much deep thinking, that continuous pain could cause serious stress. That pain itself could cause that stress, and we know that stress hormones could even result in hypertension and other non-communicable diseases. The World Health Organization has estimated that as many as 1 in 10 adult individuals are newly diagnosed with chronic pain each year. And that's the International Association for the Study of Pain that really did that study. In treating pain as the cause of any derangement or disease, we need to know the following. Did the pain precede the disease? Or how strong is the association? Does the association become stronger with increasing pain? Is the association specific? These are all things that you want to really get at to know the cause of any identified derangement or disease. Yeah, with the high incident rates of pain, chronic pains, one need research finding to really assist in declaring pain, chronic pain especially, as a disease. So let's look at some research findings. A study found that growth hormones dysfunction was associated with increased pain scores during an exercise test, as well as with higher pre-exercise level of interleukin 6 and interleukin 8. The finders are the names of the researchers are listed and the work they found. Another research finding study on fibromyalgia found the baseline level of serum free insulin growth factor 1 did not change during high or low intensity of aerobic exercise. The changes in IGF-1 correlated positively with a variation in CSF substance P and nuclear protein Y and pain threshold. That's that word, the pain threshold. These data indicate a beneficial role of IGF-1 during exercises in fibromyalgia. Meanwhile, agents that inhibit substance P activity are currently being investigated as potential drug for pain relief and other clinical conditions. So when we are now talking of potential drug for pain, and we are talking of chronic pain in fibromyalgia, then you could associate pain with Now that we now know that pains, apart from it being a sign and symptom, could also, especially when it's a chronic pain, a chronic pain has been well defined. Then you know what other tests you can even suggest to whoever is taking care of your health. Subscribe and you continue to enjoy more of my production.